Hello, Dr. Vikki Petersen here. Today I want to talk to you about a symptom that's very common for Americans. And people call it GERD, they call it reflux disease, they call it acid reflux. And basically what it is that the contents of the stomach, or the acid in the stomach, is going back up the esophagus, and people are feeling burning, heartburn, etc. And it's interesting because we're going to be talking about the association between GERD and celiac disease, and of course the gluten association, because the esophagus itself has not been an area of the body that's really been thought to be affected by gluten so much. And pretty much everywhere else in the body has been, but not so much the esophagus. So there's two studies I wanted to mention today. There's a lot of numbers associated with these, so excuse me while I look at my notes. But the first one was in 2008. It was in the Journal of Gastroenterology and Hepatology. And by the way, hepatology just refers to the liver, study of the liver. And what they found was, what they did was they took patients with celiac disease and then healthy controls, and they all had GERD, reflux disease, and they put them on what's called a proton pump inhibitor, basically just a very common drug for reflux disease. They put them on it for 8 weeks and then stopped. During those 8 weeks, the patients with the celiac disease actually had 86% resolution of their symptoms, while those, the healthy normal controls that still had the reflux, only got 67% of that population were resolved. So it was interesting that the celiacs did a little bit better. Of course, part of the study was to make sure that the celiacs were on a perfect gluten-free diet. So later on in the study, the authors actually suggest that the gluten could have a protective response. So we'll look into that, because as the research goes, they followed, after they took them off after the 8-week mark, they followed these individuals for 6 months, 12 months, 18 months, and 24 months. So at a 6-month interval all the way up to 2 years. And 20% of the celiacs at the 6-month mark got a recurrence. So 80% stayed great, no symptoms, and 20% had a recurrence. But then for the celiac population at the 12-month, 18-month, and 24-month mark, 0. None of them had a recurrence, which is highly unusual when you're looking at GERD. Typically people go on these drugs and then they get relief for a while and the symptoms come back. Now, in the healthy, normal population that did not have celiac, but of course had the reflux, for them, at the 6-month mark, 30%, so instead of 20, 30% had their symptoms recur. But then another 30% and another 38% and another 40%, so more and more and more got recurrences as the time span went farther and farther out, showing they didn't get any protective response. That drug worked for a while, and then they were pretty much right back to where they started. So not only did they feel that statistically those with celiac disease, gluten intolerance, were affected more than the healthy normal population with the symptom of GERD, but that they did so much better because they were on a gluten-free diet. It's pretty interesting. And the one other part, that point that they mentioned that I thought was really fascinating, is we talk about a leaky gut and how you know, the intestine should be a nice sort of closed portal, only, you know, selectively allowing good things like food to leave. And when it gets overly leaky, we have problems with partially digested food and toxins and bacteria and all sorts of problems occurring from that. These authors actually suggested that for those who are gluten intolerant, that leakiness could actually transfer up to the esophagus. So you could have a leaky esophagus causing the more acid symptoms for those with celiac. So pretty fascinating, but definitely something to look into. Now, a later study in 2011, this was from Clinical Gastroenterology and Hepatology, a different journal, and they looked at 133 people suffering from celiac disease versus 70 normal control, and the ratio was 30% of those with celiac had the symptom of the acid reflux, while only 6% of the healthy controls. So corroborating what the earlier study found, that it's more common in those with celiac disease. And they found, though, that after 3 months on a gluten-free diet, there was a very rapid and persistent improvement. So really the same results with these two very, very good studies. So what does this tell us? It tells us that a symptom that's very, very common could actually be showing us that people are gluten intolerant, and that should be looked for. Plus, being gluten-free is actually having a protective response and allowing those with the symptom to really get resolved better than people who aren't gluten intolerant. So what does that mean? Does that mean that those who aren't gluten intolerant, if they actually eliminated gluten, they would persistently not have their symptoms? That's the next study, huh? So there's always another study. But I think hopefully you found this as interesting as I did. There are children on drugs for acid reflux. As I said, 20% of the population, so 1 out of 5 of us have this problem. So another interesting connection to gluten. I hope you found it interesting, and please send me your questions. I do love to hear from you. And until next time, I wish you very good health.